You look out the window, and the patient's smoking.
Oh my God.
What is? How does that make you feel?
Like a
Now let's talk about patients that don't believe in medication. Have you guys had those?
Yes.
That you tell them, well, here's a anti-inflammatory, pain, antibiotic, and they don't want to take them, but they don't tell you.
Oh, yeah. I have a bad experience with patients with alcohol. No medication and just alcohol. The second or the third day, a lot of inflammation.
What are the ones that come drunk?
They're the same thing, and they say, "Oh no, I don't smoke anymore." And
then you can see it. You can see it.
Please.
Like there's still smoke coming out of their nose. Like, sir, either you're burning or you're smoking.
well, some of the patients they don't want because they take like medicine, natural pills or garlic or onions.
But it could have been avoided if they would have just followed the directions. You know?
And we see the difference. This is important, I think. We see the difference when the patient follow all the instructions. Everything, the bone, the gums, the implants heal perfect.
If you're at home and something does happen to any of your dental work that we've done or any dental clinic has done before, please call the dental office.
It was all a dream. I used to read Word Up magazine. Salt and pepper and heavy D up in the limousine.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. Listen, we're on Spotify, we're on Apple Podcasts. You can rehear your favorite shows, your favorite episodes, regardless of whatever you're going through in your dental journey. And today we have Dr. Luis.
Hello.
We have Dr. Dulce.
Hi.
And we have Dr. Alonso.
Hello, everyone.
Welcome back, guys. So I want to start off by saying, a lot of times we have patients that come in and patients are super excited about getting their final work. Perhaps they've seen our work that we've done before. They've seen work on the internet, work on the web. But when they get here, a lot of the times they don't want to follow what the doctor tells them about. So, for example, indications perhaps of how to take care of certain things or what medications to take. And we want to talk a little bit about that because we want to see if it's really necessary or if it's not really necessary. Okay? So we'll start off with you, Dr. Dulce. Obviously you are all about veneers, you're all about crowns. Mm-hmm. And sometimes you tell patients to be careful with their temporaries. Very important, I know that you said before, when somebody comes for veneers, to get a mock-up.
Yes.
And to give themselves an extra day. Because when they get their final work and they don't like it, we could still change it.
Yes, we can make the veneers again.
But if we cement them, then we can't do anything about it.
No.
So let me know, what do you think about the different things, the different ways of patients, how to take care of temporaries? How important is it for for patients to take care of that?
Well, when the patients use the temporaries, they need to eat just soft food. They can clean like the regular teeth, but sometimes, like it's a temporary, if the patient eats something hard, the temporary can pop off, or the tooth can be decapitated.
What happens? Oh, so if the temporary breaks,
Yes.
the tooth underneath that you have shaved down to put the permanent the next day can break off.
The temporary, yes, of course.
But what about the teeth underneath?
Oh, the teeth, that can happen if the patient's back to home or it's past like 6 months, 8 months, a year, and the patient doesn't come back for the permanent work, that can happen.
So let's say that I come in and you're doing a full mouth on me.
Yeah.
Okay. And you finish doing my uppers and you put temporaries on me. And I have to come back the next day or the day after. But I should be eating salad, sandwiches, Jell-O, soft, because they're just temporaries. but I go out there and I start eating tostadas, or I start eating things that I love but I shouldn't be eating. What happens if my temporary breaks and I keep on eating with the teeth underneath and one of my teeth breaks? What happens then?
Oh, if the temporary break, you are going to feel just sensitive
Okay.
for the cold, the air, and something extreme. If the tooth can break it, we can do our root canal, or sometimes we need to pull it out.
So whatever you already prepped, whatever you
Yeah.
already did, now it's completely different. So it's very important for patients to eat soft foods
And take care.
and take care of their temporaries, because if not, whatever you did could change completely.
Oh, yes.
What about veneers? So I'm coming in, you show me my veneers, I like them, I love them,
You love it.
and then I put them on, and then I'm like, well, no, I like them, and you cement them, and then after I look at myself, after you cement them, I'm like, you know what, I wanted them a little bit longer. What can you do?
We need to remove the veneer.
You mean you cannot just wave a magical wand and make them?
No. Well,
Wow.
no.
Because that has happened before, as we know. And we tell the patients out there, when you give us the green light, we cement and we can make adjustments. Perhaps on veneers is really hard to make adjustments, correct? But on crowns, we could perhaps bring it down a little bit. But we can't make them longer. We cannot make them a whiter color.
No.
Because once we cement, that's it.
That's it.
Because we get patients that come in and they're like, oh, yeah, I love them. Then they cement them, and the next day they come back to get the bottom, and they're like, you know what, I was thinking, and I want them a different shape, or I want them a different color.
Yeah, we need to do everything again.
That's why it's very important. For example, you are the doctor. You need check the everything, the anatomy, the contact, the color, everything, because the opinion of the doctor is the best opinion. Sometimes the patient, the opinion is I like it, everything is good. But for example, on the second day, they can explain another problems. I don't like now. I think it's too big. I don't like the color, but we don't have more options.
Yeah, we can't change the color.
Yeah, yeah.
And I think is what happened is if we take the decision to remove the crowns for any reasons, we have to remove all the crowns and then shave a little bit more the tooth, and that make weak
Yeah.
the natural tooth.
Yeah, and like
So
on
that's-
an Emacs that she does, it's even harder because now
Yeah.
you can't just break the crown off.
No.
You have to reshave.
Right.
So now you guys that do all on fours, somebody does an immediate load,
Well,
okay?
yeah.
And they're supposed to come back in 4 months, 6 months. What if they don't come back to like a year and a half, Dr. Alonso? What happens then?
Well, there is a lot of things that can happen. I think one of the things more important is come back in the correct time. Between 4 now with the Straumann implants, we know the patients know we can do the final teeth in 2 months and a half,
Yeah.
10 weeks. With the other brand of the implants, with the Neo implants, we can do it in 4 months, but no more. The thing is, what happened is the implants take those months for heal, but once the implants are healed, we can continue with doing the final
permanent.
treatment, right? But if the patient wait a little bit more longer, the thing is the screws can fall out, and then one part of the arch start to have mobility, and the problem is one of the implants can damage, can have problems with one of the implants, and then continue with another implant because
Yeah.
everything is how can I say in English, like a palancas?
Everything's in balance.
Balance.
But if for
Right.
any reason one of them gets loose, then it starts putting extra weight on the rest.
Right.
And it starts pulling until it
Yeah.
hurts the other implant. Because it's very important, because it's just a temporary. And you guys put these temporaries on so the patients could have teeth in their mouth, so the patients could have their bite perfect when they come back. They'll be more used to having something there. a lot of patients are in the public and they need to have something there. And also for the healing process, because when they come back, you guys no longer have to cut or anything like that. So it's a win for everybody. But when patients come back way after, then it can have complications.
Problems can happen.
And that has nothing to do with us anymore. Because if you come back in 8 months or a year, when you should have been back in 4 months or 3 months, that temporary was only made for those months.
For those ones, right?
And if it was for longer, good for you, but it could have affected everything else we did. And now maybe an implant's bad or 2 implants are bad, but that's where like people are like, well, what about warranty? Yeah, well, we're going to honor the warranty, but maybe we shouldn't be honoring the warranty because you should have been back to get it done for the same reason. Because now it's like me knowing that my tires are very worn down. I don't have tires on my car and I should change them every 50,000 miles and I've run them for 150,000. And then my rim messes up. Well, it's because I didn't change my tire. It's not my rim's fault. It's not my car's fault. It's my tire's fault. And these temporaries are like temporary tires.
And to be honest, the temporary teeth, they looks nice. They look good, and they have a good colors. We try to make the best size of the teeth and the bite for the temporary teeth. And sometimes the patients they say, well, they looks really nice. They looks really good. What's the reason I need the permanent ones? But the thing is that material, the temporary material, is just acrylic. The acrylic is not a strong material. So they can break, the teeth can fall out. So there is a lot of things that can happen.
If you compare the temporary material with any permanent material, I don't know, for example, Cerpic, zirconium, metal and acrylic, the difference is the flexion. The acrylic is more flexible.
The flexibility.
Flexibility. The acrylic is more flexibility.
It has more The acrylic has more flexibility.
Of course. Now,
More flexible.
imagine this situation. You lose one screw. That's completely normal after 5-6 months. Why? Because the muscle has a memory, the old memory.
We're talking about a screw, not the implant. The screw.
The connector.
The connector that's putting the temporary grabbed onto the implant.
Yes.
Okay.
Or is the first step. Okay. And the second step is different ways. For example, the first way is you can break the acrylic, or the second way is you can lose the next implant a little more. If you lose the second implant, you can lose the mini screw, the connector, and you can continue with the next and the next. Probably you can break your denture, and you can continue for more months and months and months. And I don't know, the final results is you lose everything.
Yeah, very important, very important. If you guys lose, if you guys are, with your temporaries on, whichever temporaries you have, and something happens, give us a call. We'll let you know what's going on. Well, this broke. Okay, well, we could do this, we can do that, but give us a call, because we've had 2 weeks ago, we had a patient from you that she came in and she never told us that her temporary was loose. Yeah. I don't know if you remember. She's a lady. She never told us that her temporary was loose, and she had an accident, and she didn't come back, and it was over a year.
Oh, yeah, I remember. Yeah.
It was over a year, but she's had it loose since like the 3rd or 4th month. So she's had it loose for quite some time. Which when she came in, that implant was gone, and she had lost a lot of. To start with, the surgery was very complicated, so she didn't have much bone to put on. So we're like, well, we're gonna try to redo it, but this time we're not gonna do an immediate load, because, and she told us, oh, I don't want to feel like it's just my fault. But in reality, if you're at home and something does happen to any of your dental work that we've done or any dental clinic has done before, please call the dental office. Hey, this is going on. Send pictures, send videos, whatever you can send. Maybe the dental office, like us, maybe we're in Mexico and you're in New York. Maybe we'll tell you, well, go to your dentist in New York because it's an easy fix.
Yep.
Maybe we tell you come down again. And you're like, wow, but I have to go all the way down again. But it's better than if you come down all the way down in months and then all your work is bad because of that thing that happened. You know, it's very important that there's communication. Very, very important. Now let's talk about patients that don't believe in medication. Have you guys had those?
Yes.
That you tell them, well, here's a anti-inflammatory, pain, antibiotic, and they don't want to take them, but they don't tell you. Then they come back on the third day and they're just like,
Oh yeah.
boom.
Oh.
Yeah.
What about those? Anybody has any stories on those?
Oh yeah. I have a bad experience with patients with alcohol. No medication and just alcohol. The second or the third date, a lot of inflammation.
It's a lot of
And
alcohol from the inside.
asks the same question is why I am so swelling. It's because you stop the medication.
Right.
That is the reason.
Well, George thinks that alcohol solves everything.
But George,
Yeah, he said alcohol, and George is like,
John,
Helps to disinfect it.
yeah. They say alcohol is good on the outside. Just imagine in the inside. That's what he's saying.
yeah.
But so, who else has anything else that's happened to you with patients?
Yeah, we have a lot of patients. Sorry, we have a lot of patients. They say, "Oh no, I don't need this." For example, this kind of the treatments for extractions or bone grafting or implants or root canals. Sometimes we have to give
root canals, yeah.
yeah, root canals. We have to give antibiotics, and the antibiotics is really, really important. If the doctor said take this medication, the antibiotics is for something. We see in X-rays sometimes infections, or we see the extraction was very complicated, or we remove a little bone.
We know the situation.
We know the situation. We
Yeah.
know how work the body.
Yeah.
So the recommendation always will be for give something a better treatment, better healing.
A better chance to be successful.
Right.
Successful, yeah.
So and when the patients say, "Oh, I don't need it," just I am focusing. You have to. It's not like you can. You have to take the antibiotics.
It's not an option.
It's not an option. You have to take the antibiotics. All right. See, if you don't feel any pain, okay, forget about take the painkillers or the anti-inflammatories. But the antibiotics
It's
is
the most
100%
Yeah.
very important.
To protect the work.
Yes.
Yes.
What about you, Dr. Dulce?
Well, some of the patients, they don't want because they take like medicine, natural pills or garlic or onions. They don't want to take the antibiotics.
Right. Look, we don't have anything against anybody who does. I don't know what that's called. What is that called? Like nature medicine.
It's good. It's good, but with the antibiotics, can be work better.
Look, guys, do you guys make money? Does the pharmacy gives us money when we send them people to get stuff?
Not yet.
No.
Not yet. Then we should probably work. We should probably work on that. But guys, we're not getting paid when we send you to get medication. If you want to take nature medicine, medical, if you guys want to have like the little leaves or the garlic or the onion or the hot water compressed with salt, go for it. But also take the antibiotic, if possible. The pain and the anti-inflammatory, they're not narcotics. They're not opioids, right? You're not gonna get hooked on them. You're not. You can cross them. There's no problem. But it's gonna make everything better for you and for us because these guys want to secure their work.
Right.
If you come back the second day or the third day and you're like a chipmunk, she can't submit on you anymore, or the crowns, or you guys can't continue with the work you were gonna do, and now the patient have to stay longer, and now the patient's mad.
Yes.
But it could have been avoided if they would have just followed the directions.
Yeah.
When you go to the cardiologist, and he just did something on your heart, you're gonna follow directions. Just because these guys do a really good work, and you don't feel any pain, doesn't mean that what they did wasn't really, was easy. Sometimes I've seen some of their surgeries or their before and afters, and you're like, whoa, you guys are the ones that are prepping up and taking all those cavities out in making sure that everything's good. You're the guys that are taking out the teeth, all the teeth, the bone. You're scraping. You're finding different things. I've seen things. I've seen some things.
And we have to remember, in mouth there is a lot of bacteria. Bacteria are everywhere, but in mouth there is a lot of bacteria. So to try to prevent more bacteria or infections, that's the reason we offer that.
We just want everything to be as good as it can be. That's it. We just want to protect our work and protect our patients. That's all we want.
Right.
Yeah, right.
So it's very important. So you're at home, no matter what clinic you go to. If you go to Supreme, you picked right. But if you go to any other clinic, there's no problem. Make sure you follow your indications. Easy. 7 days. And I just thought about something. So when you guys ever had a surgery? Okay, on all them 4, hardcore. You guys are sweating. I think I seen that not too long ago. Like last week, you were sweating.
Oh yeah.
On a surgery. You go
Too much work.
Extended surgeries,
Yeah.
and then the patient gets up. You guys go outside. You're thirsty. You have a drink. You look out the window, and the patient's smoking.
Oh my God.
What is? How does that make you feel?
Like
I take a pictures.
Yeah, but how does that make you feel?
right.
Does it make you
a heart
mad?
attack.
Yeah. Are you like, what are you doing? I was just helping you for like 4 hours, 6 hours. I did the best work possible.
Give me that, please.
Yeah, you probably would
Yeah.
take the police off, but and now you're tending it for it to fail.
Yeah.
Like how do you guys feel when you see that? You just and the patient's like, and then all of a sudden you're like, and they're drinking a beer.
Easy. If I see
I feel nerves.
if I see that things, if I see smoking the patient after the procedures, I write in the record.
In the record, yeah, it's important.
But
It's really important.
As professionals, though, how does that make you feel? Because you guys just gave it your all. Because you want everything to be perfect, and you guys take a lot of times a lot longer. You taking a lot longer on a patient when you're going in there to make sure all the teeth are well prepared. You guys, when you go in there to scrape and extract, and you guys are all careful when you guys are putting the sutures and everything is perfect. Oh, Frank, this looks beautiful, and then all of a sudden,
Can you check the?
You not respect my work.
no respect.
No
I
respect.
respect the work, yeah.
No respect in the work. It's like a slap in your face.
Right.
Any problem? It's not my problem. It's a reality.
Because I remember, I don't know if it was one of you guys. I'm pretty sure it happened at some point, but I remember a doctor once came up to me and was like, Frank, look, I have these pictures and these videos. What are we going to do? Like, this patient, like, how can we give him warranty? Because the antibiotic is out the door because they're drinking alcohol.
Mm-hmm.
And they're smoking and they're still bleeding and they're smoking. All that tobacco, everything is going in their
Tobacco and
wounds.
bleeding. Yeah.
In their wounds.
Yes.
Like all your surgery just,
Right.
Right.
but sometimes it still works.
Sometimes it still works.
We understand. It's very complicated. Stop.
To stop smoking.
Yeah, I know. We know.
Yeah.
But if you can wait maybe 3-4 days, it's a good time because after these days, the gum is closed.
Or the other ways.
Well, 4 or 5 days is the
Right.
better time. Why? Because we understand it's very difficult to stop this
Yeah.
activity.
Or sometimes they use like the nicotine part.
Nicotine patch, huh?
Right.
Uh-huh.
Like put 2 of them or what? Like double?
Double.
That would be better.
Yeah.
Like,
Better than a smoke. You're right.
I mean, if you smoke 10 cigarettes a day, put some nicotine patches and perhaps smoke only one. I mean, but we've seen people that just walk out the door and then just start smoking.
Mm-hmm.
That's just like I've always seen it. I'm like, I can't believe it. But to you guys, I see your guys' face because you guys are like, I just had this great surgery. And then you're like, that's your face. Like, But
Yeah.
why are you sad, man? Are you okay?
I remember.
Is he bringing flashbacks? Are you
Yeah,
okay?
yeah.
Oh,
We
no,
have a bad
man.
experience with this
That is very
with
common.
this patient.
Is that
Yeah.
a dentist?
very, very
is
common.
that a dentist nightmare? like doing a perfect work, and then all of a sudden the patient doesn't take care of it. That's crazy.
Yeah, just we walk around the corner and he's smoking right there. It's like I wanna see you. I wanna see you right here or in the corner or the next street.
Or for example, on the follow-up appointment, when I explain, open your mouth, please. Oh my
They
gosh.
smell.
Yes,
Yeah.
smell.
It smells like cigarettes.
Yeah, cigarettes.
Yeah,
Too much.
What are the ones that come drunk?
they're the same thing. And they say, "Oh no, I don't smoke anymore." And
And then you can see it. You can see it.
Please.
Like
please.
there's still smoke coming out of their nose. You're like, sir, either you're burning or you're smoking. Or the ones that come half drunk and they're just like, oh man, I just had a drink. And they were just sitting in front. They had like 6 bottles in front of them.
Mm-hmm.
No, it wasn't George. We're talking about a patient. No, you're good. We're not talking about when you went to Vegas, bro. No, you're good. So yeah, man. So very important, guys. You guys back at home, 50%. I always tell this to our patients. 50% of the work is done here, even though it looks like a lot more. And 50% of the work is done back at home. It just matters how much you want everything to be good. You know, sometimes the patient does great and we do great, and sometimes still little hiccups come up because it's medical and it happens. But let's just give it the best fighting chance for it to be great.
Yeah.
You know?
And we see the difference. This is important, I think. We see the difference when the patient follow all the instructions. Everything, the bone, the gums, the implants heal perfect, and we can give something more nice, more cosmetic, more functional. So
No surprise.
No surprise. Yeah, the implants are completely also
Healed.
integrations in the bone. So. Yeah, we do all this treatment because it's a lot of treatments, it's a lot of time, it's expensive. So try to follow all the instructions, and also because we in all the treatments we try to offer or we try to give the guarantee.
The warranty.
We
Yeah.
try to
Warranty,
give
very
warranties.
important. Yeah, because all of our patients want their warranty.
Yes,
problem.
but we're gonna respect all the warranties,
Yeah.
but they have to follow all the instructions also.
Yeah.
Sometimes we don't have another opportunity to do the surgery. Remember, it's
Right.
important. The bone conditions sometimes is not good.
Yes.
Sometimes it's only one opportunity.
They need to take care.
Yes.
I feel the tension. In the room. You guys, I don't want you guys to get mad at me. I was just talking about it. Well, is there anything else you guys want to say before we leave? You guys all good? Anything else? You guys want to say hi to somebody? You guys want to say something to the patients out there that are listening? We're over 1,000 followers, so we, congratulations to you guys more than anything. Thank you guys for everything. You know, we got claps and we got hugs for each and every one of you guys. Thank you for letting your loved ones know about us, and thank you for following. You know, we're here for you guys. But anything else you guys want to close with?
Oh, thank you for your attention. Remember, we have a instruction in a paper at 4 or 5 pages, and you can check this information. It's the instruction after the surgery. Okay, it's very important. Check the information.
Anything else, you guys?
Come to Supreme.
Okay.
Thank you for coming. We're gonna try to give the best always. Yeah.
All right. Well, there you go, guys. Well, thank you once again for joining us here at Supreme Dental Podcast, powered by Supreme Dental. And take care so you can keep on smiling. Have a good one.
Thank you.
And if you don't know, now you know, you know, you know.
That's right. So.
And if you don't know, now you know, you know.